Thank you for taking the time to speak to us today. I know you're a very busy lady, and you've got such a vast amount of experience over 30 years in this industry and helping patients and everything. So it's just such an honour to be able to do a Q&A with you.
Well, I'm thrilled to be here, and it's been my life's work, you know. My experience with this isn't what has taught me. What has taught me is spending lots of time listening to people like you and those in your group who have given me the privilege of partnering with them in their rehabilitation. One of the most interesting things I did historically, because I like history and medicine, is to understand Vincent van Gogh. Are you familiar with his paintings of Starry Night?
I studied him for my GCSE, actually.
You did?
Level, yeah. And there was 3 artists, Vincent van Gogh, Matisse, and Monet. So I did 3.
Wonderful.
And because I went on to do art college, and I chose those for my subject, my focus, and he is the most fascinating, well, you know, let's face it, you know, the mental side and the artistic side, it's incredible, actually. So I learned about him at an early age, maybe not so much the mental side back then, but more of his art, but
sure. But look at his art. And so many historians would say that he had epilepsy. That was always the thing. But he would write letters to his sister and use the word vertige. And it was his vertigo. He would say vertige. And he would have these onsets. And the interesting thing about him is he knew these episodes were coming. He had some, what we call a pre-drome, or, you know, like an aura or something that came before he would feel bad, such that he would walk himself to the insane asylum and hospital and put himself in for a time until he would feel better.
Tinnitus or tinnitus, as you'd say, tinnitus?
He might have had tinnitus. I know mostly about his vertigo, that he just couldn't stop the movement.
I heard that he did have some tinnitus, you know, some ringing in the ears of some sort, and
and probably
his
he ended up cutting his ear off. That's right. So it is likely that he had vertigo and tinnitus and some fluctuating hearing loss. And then you see in his paintings that he had some visual symptoms too. All this swirling.
So,
yes. So even before we really understood that the vestibular system was all the things that it did, that it controlled eye movements, and that it helped us stay steady and feel steady, and it could make us feel sick, or it could make our ears ring. One of the world's greatest artists and painters, of Vincent van Gogh, understood this. I think the scientific papers now say that he probably had Meniere's disease, because it was, a lot of times they said epilepsy, but you don't feel a seizure coming on necessarily and walk yourself to the hospital. That would be more likely of other kinds of vestibular problems. And very interesting that science didn't know, but he did, and ended up cutting off his ear. But that was a diversion into art history, but an interesting one, because this has been around for a long time. Vestibular disorders aren't new. They are quite old. They're as old as we are, although the field of vestibular therapy and vestibular diagnostics and even vestibular support like this is certainly new. VITA, the Vestibular Disorders Association, has been around as long as I have been in the field. It was once just a couple of people who volunteered to take questions and calls from people 30 years ago. But now it's a worldwide organization. And I love that you serve as an ambassador for VITA. You have spread awareness and understanding to countless numbers of people through your work online. The vestibular system is such a broad topic. And as I looked at the questions that people were asking, they also were quite broad.
They are,
and
in the group.
It's sort of like, it's very non-specific, and there are different kinds of diseases and disorders within the vestibular field. And so today, while I'm not going to talk specifically about disorders, I can talk about whatever I want to, but I wanted to touch on some of the things here that got the attention, like some complementary and alternative approaches. People want to know how to feel better. you know?
Yeah, they do, and I think they're just desperate for answers. And you know, that going back to sort of this group and the other groups out there, there's lots of really good groups as well, on top of mummy seeing double. But it's great that we have a group that's like a family, and we're there to support people. And I think the common thing with vestibular or whatever you have invisible illness is the loneliness you feel. You know, the desperation to get better, and the loneliness. And unfortunately, when I was at my worst, groups like this didn't exist, and I didn't really have anyone to talk to. But you know, that's a shame. But that's why I spread awareness. And what's so good about these groups is that they're here now to help people feel less alone and chat about, you know, their daily lives, you know, dealing with these things.
Well, let's think about what you just said there. You said the feeling of loneliness affects our body and affects the way we feel and affects how we function. So we really can't separate this mind-body connection. We can't. When I say that I'm a holistic practitioner, it's because I learned very early on that if you feel fully supported and understanding of your disorder, you might have a very different experience going through the process than if you feel afraid and alone and you've never known anything about it. The tone of the voice of your doctor can determine whether you leave the doctor's office feeling hope or feeling despair. So, you know, when we look at recovery and we look at coping and strategies and living with this invisible illness, you'll hear me talk a lot about the mind, the body, and the holistic part of this, because our nervous system, which is our internal computer processor, is connected to everything, our thoughts, our emotions, and not to mention, you know, our real nerves and eyes, ears, nose, throat, gut, and it's a holistic part. So for us to seek wellness, we often have to look at everything. And my background is in diagnostics of the vestibular system. Even though I had the highest level diagnostics, that wasn't healing for people. No. For me to tell you what you have with such specificity doesn't change the way you feel leaving, except that maybe you have some understanding.
Yeah.
But then you go, then what? Then what? Then what? What do I do? So, you know, I ended up separating from just diagnostics and committed to just trying to find out how to help people feel better on my own. And that's led to a very scientific approaches to what does the literature say about vestibular rehabilitation, but also a holistic and alternative or complementary approach to say, what does sleep have to do with it? What does stress have to do with it?
Yeah, and I didn't really get much sleep last night, and I'm really
well, and you know, when well, let me back up to say this, that my patients were my teachers. And this is what I started to say, that you've given me the privilege of being with you when you have had an illness and you want my help. And I hear and listen and listen and listen. And what I learned was there were certain reasons why people didn't get better.
Yeah.
And one of those things was had to do not with the severity of the illness or the disease, but of the circumstances around the lifestyle that the person would have. So I used to always say, if you're not better when I finish with you, it's either because you're not doing what I say you're doing, because your injury is too big to be recovered from, or, you know, there's other things in your life clouding up your nervous system so that your nervous system isn't in a place of recovery.
Oh, I totally believe that. And I think, you know, having been on the mindset and sort of, you know, that approach journey over the last few years, I had to simplify my life.
Yeah.
I was doing far too much for even a person without vestibular conditions. And I was a governor at a school. I ran 3 businesses. I had 2 twin girls. I was, you know, trying to manage the house. I was being a wife. I was being a cook. It just like got too much. And I remember my consultant saying, you need to simplify things. And I was like, really? And actually I did. I had to really strip things back to basics, concentrate on the mindset, do more, move to improve, you know, do stuff around my medical treatment plan, for example, there's other stuff we can do to help ourselves heal quicker, as it were, although it is not overnight. But it's certainly taken me a 3-year mindset healing journey, I would say, just to sort of, do stuff to help myself that is actually coming from within, rather than externalizing,
Well, and I think that's important. What I can say is that while, depending on the type of vestibular disorder, we some vestibular problems have a positive outcome with rehabilitation. We expect a cure or a resolution of symptoms, and others problems that come and go, like Meniere's disease. Let me back up and say, with BPPV, for example, it should be treated or corrected, and there should be no symptoms. With something like Meniere's disease, it is an episodic vestibular problem where you might feel normal in between episodes. And that's a little bit like vestibular migraine too. I mean, that you have, people have episodes of, I shouldn't move my hands with dissipation.
Like
Sorry. Sorry, I always do that. People go, don't do that. Don't do that.
It's like a mountain.
So, so with those that are episodic, it's very difficult for the brain to adapt, because it is better at adapting at static changes. Do you know what I mean by that? That means a change that is permanent or fixed. Sort of, it can adjust. So if I was to lose a whole inner ear from an accident or an injury or a virus, even the complete vestibular system, I should be able to balance that out if my brain is normal. So with what we call a one-sided or unilateral vestibular deficit, we expect people to get better. Their eye movements.
I had vestibularneuritis that damaged 2 nerves in my ear from repeated viral attacks. And yeah, it took a couple of years, but I have got so much better on that vestibular disorder. So you can, your body can,
your body can adjust. Particularly looking at children who are born with congenital vestibular problems. There were some who have a congenital loss of hearing and vestibular function, and they walk and they play and they do all sorts of things. And we so it's amazing. There are certain conditions where they can't maintain their balance. Do you know what those would be? Does anyone know? If you had no vestibular system at all, what would be the conditions under which that you couldn't stand up? Does anybody know? What do you think, Laura? So you'd see a child running and playing and being on the playground, and they would look really normal because they're born this way.
Yeah.
But you would know they have a vestibular problem a couple of ways on the playground specifically. I can think of a couple of things.
My brain's gone blank.
Well, they probably, they might not be able to, they might have more difficulty on the balance beam than another child. But more specifically, if they closed their eyes and stood on the rocky, unstable surface of the playground, whether it's sand or gravel or whatever, they took away their vision, and then they had an unsteady surface they were standing on, they couldn't tell which way is up.
No.
They would not be able to. But they compensate so beautifully with vision from day one that they're able to find equilibrium in the visual references that they find, whether it be the corner of the room, the horizon, or whatever it is. They orient themselves to vertical.
And that's a question that I've got that actually isn't in the questions that we're going to do, but before I forget it, out of this very tired brain, of mine today, if you are a young person, 10 years old, and you've got a young vestibular and you've got young eyes and a young system, can a person that's, say, my age, 44, or someone who's 50 or 60, learn to compensate? Can you do that?
Well, yes. Age is not a limiter in the ability to compensate, but wellness is. Wellness and lifestyle and overall health is, but age is not the discriminator by any means, nor is length of time since injury. So, you know, people can still have recovery long after injury if because of neuroplasticity. Your group probably has heard this if you talked with you
yes,
know,
I did
Joey.
an interview with Joey again. Yeah.
Yes.
It was about a month or so ago, I think. Yeah. So neuroplasticity is brilliant. Yeah.
It is brilliant. And, you know, we've been talking about neuroplasticity in physical rehabilitation for a long, long time, understanding and appreciating that the brain has an incredible ability to compensate and rewire for things that are missing. And again, it just has more difficulty rewiring when things are episodic. It takes a little more work to do that. And she has given some beautiful strategies for that. But age is not the reason why.
That's good to know, because I have a lot of people that contact me who are, say, 55, 60, and they're like, well, there's no hope for me because my age will compensate. And I'm like, well, brains are amazing. You know, it can help. So,
well, if we honor our body will honor us.
Yeah.
And this is what I really, really feel is a global message today, because we all need to be thinking about, am I treating my body well and my nervous system? That's the holistic approach to it. That's the idea of the mindset and the rest and the nutrition and digestion and all of the things, making sure that we are eating food that has nutrition for our body and all parts of our body, and that we're balanced.
Takes us on to the topics that people had chosen. So the first one was complementary and alternative approaches. So you're talking things like homeopathy, acupuncture, osteopathy.
Yeah. Let me see if I can share my screen. The word CAM is complementary and alternative medicine. And I'm just going to point out the circles. The red circle is whole medical systems. And these, well, let me first define complementary medicine. Complementary and alternative medicine. Complementary means that it adds to what the medical practitioner has given you, and alternative means it's instead of a medical advice. So doctors are starting to appreciate the benefits of adding, for example, massage or mindfulness or meditation to their medical treatments of medicine or surgery or whatever it is that they do. So that would be a complementary approach. And then an alternative approach would be someone who says, I don't want to go to the doctor for whatever reason, whether it be they don't have the resources to do that, or they don't have access, or they want to try something on their own. That'd be someone saying, you know, I have vertigo and I'm going to go get some acupuncture. That would be an alternative. So the field of CAM, or complementary and alternative medical approaches, includes whole medical systems like traditional Chinese medicine. I'm looking at the red thing now at the top. Ayurvedic medicine, which is primarily from India. Homeopathy, which looks at plant-based approaches that sometimes based on the idea that the cause of the problem can be the cure. Naturopathy is, again, a mixture of, is a whole medical system based on supplementation and natural remedies like herbs and things like that. Then there's biology-based practices that are used individually, like people are using probiotics. We were talking about gut health, vitamins and supplements and herbal products. In the green is energy medicine. That's part of complementary or alternative approaches. People use spiritual healing. They used Tai Chi and Qigong and distance healing, using energy, Reiki and things like that. There's manipulative and body-based practices in blue that are part of complementary alternative, and that includes chiropractic and osteopathic and massage. And the mind-body interventions like meditation, hypnosis, and yoga. So there's a lot of different types of complementary and alternative approaches. But I wanted to share this with the group. When people are critical of complementary and alternative approaches, and I am because I'm science-based, I want to say, well, how much research is there to support acupuncture, let's say, or acupressure, or essential oils, or things like that? Well, we must also look at how effective medical treatments are. And this slide, which I can share again later, you know, says that when we looked at 3,000 treatments. These are traditional medical treatments. We looked at 3,000 of them. We looked at how effective are they. Do you know that 50% of normal traditional medical approaches have unknown effectiveness? 11% only are proven beneficial. 24%, almost a third, are likely to be beneficial. So again, when we call it practicing medicine, this shows you that it really is practice. The doctors don't always know whether something they try for you is going to help you or not. So I think that's partly responsible for the rise in popularity of complementary and alternative medicine. And there's a distrust of the traditional medical model, which we call the Western model of medicine, because we don't know what research to believe. And we look to believe in something. And the belief in the potential outcome of complementary and alternative approaches sometimes is all it takes for there to be a benefit from it. We must trust and believe in whatever remedy we are giving our body, because we have this intimate relationship with our body, and the energy of our body to receive a healing must come with a trust in it. So there will be more research in complementary and alternative approaches, but understand that just the belief in something alone makes it possible for it to be beneficial. Do you think that's true?
Yeah. It's interesting because, you know, I've seen so many consultants and neurologists and all sorts of people, and you know, they're quite. I know they're sort of wising up to a few things, like you said, you know, mindfulness and everything now. But you know, back when I was seeing a lot of them, you know, what I kept saying, sort of, what can I do additionally to help over and above medication, or you know, is acupuncture good, or what supplement is good, and you know, and they would never really stick to anything, and now I know why. So 50% is, you know, that's crazy.
So, you know, that's all we can do is try something and then jump on to the next one. But I think medical advances have progressed down what's called now clinical pathways or evidence-based practice. But for a long time, you know, do you use the words evidence-based medicine in the UK?
Yeah, I think we do. Yeah, I've heard it being battered about quite a bit. Yeah.
You know, isn't it astounding that we're just now getting to this idea that it actually has to have evidence to work for us to use it?
Yeah, right.
What have we been doing all this time before that?
Exactly.
My goodness, right? We've been guessing and practicing, yes, and hopeful. So, you know, the biggest thing about the complementary and alternative approaches for people with vertigo or vestibular problems is that they're used to treat what we call these neurovegetative symptoms. Those are symptoms like nausea, vomiting, brain fog, fatigue, stress, anxiety, or sleep. And so, you know, those are the things that really have to do with overall wellness. People use complementary alternative approaches regardless of their diagnosis. So there are very, very few things within CAM that are specific to vestibular problems, but more likely they treat the overall person and interact with the nervous system. Did when Joey spoke to your group, did she talk about the autonomic nervous system? Are you familiar with parasympathetic versus sympathetic nervous system? I know what she says. She says fight, flight, or freeze.
Yeah.
So that you know that is so we have this fight, flight, or freeze, and then we have rest, digest, and restore. So we have these two opposite kinds of states, if you will, and these complementary and alternative approaches address whether we're hyped up and stimulated or whether we're calm, relaxed, and in a place to restore and renew.
I mean, it's like I suppose with the complementary and alternative approaches, similar to medication, everybody's so individual and reacts so differently to all of these things. It's so impossible to know. I suppose with research and numbers and everything, you know, you can get a gauge of kind of what works a little bit, but it's so individual, isn't it, of how we
It is. And when I gave this talk to a large audience in that virtual vestibular conference, were you a part of that?
No, I didn't. It was wrong time for my. Yeah, I should.
That's okay. So when in a large audience where we were doing polling and we were talking to people and they were weighing in on how they would respond to different parts of complementary and alternative medicine, it was all over the place. You know, it was not disease specific, so you can't say those with Meniere's need this or those with migraine need this. It really depends on you.
Yeah.
And here's what I know for sure. I know that if you're in a state of excitation such that you feel your sympathetic nervous system and your adrenaline, you talk about adrenaline is high.
You're oversensitized.
Yes. Then that is not a place where the brain can sort things out and make new connections and work on recovery. It doesn't.
Joey says that in a similar way. Your brain has to be receptive to, these things coming in, and you have to be in a state of a better place to accept them, I suppose.
It is a parasympathetic state. So that's the name of the nervous system driven by certain chemicals. It's called the parasympathetic nervous system. It is the opposite of fight or flight or freeze. It's the opposite of deer in the headlights. It's the opposite of, oh no, what's going to happen to me? So see the shoulders up, the breath is held, the tension goes, and the pupils dilate. And it is instead this, look at me, to go down and rest and relax so that the body can restore.
Yeah.
This is a beautiful segue to this idea of many patients feeling like, oh no, I'm having symptoms. And we lift ourselves up off of the ground.
I'm having a vertigo attack, or, it's like everything tenses.
And the remedy is the opposite. One of the very first things that I developed that was just pure magic for my patients was understanding. This is way before we even called it vestibular rehabilitation. We didn't have programs and certifications and everything. But I knew that we had to get the body and the brain into this restful, restorative state. And this technique is breathing, relaxing, and feeling. So I write the letters B, R, F. Let me see where my computer is. I should be able to do this. B, R, F. Breathe. Whoops. Breathe, relax, and feel. Now, breathing, relaxing, and feeling. This BRF, if you use the word, do you say the word barf in your country to be like vomit? Is barfing? Yes. Yeah. To be sick is to barf. So people who have this nausea, they remember this. They're like, oh, the barf technique. Breathing, relaxing, and feeling. So the opposite of this, afraid, is breathing, relaxing, and feeling gravity pulling you straight down into your chair. Tell yourself you're steady and not moving. I teach people to breathe, relax, and feel and orient to their surface. So if you're in a chair, let's try this together. You breathe, you relax, and you feel gravity pulling you straight down into the chair. Feel your back in the chair. Feel your seat touching the surface of the chair, and make sure your feet are relaxed in your chair, your legs are relaxed, and your feet are on the floor. Feel yourself held by the surface that is holding you, the chair or the bed or the bench. Breath is essential, and as you exhale, relax your shoulders, relax your body heavier into that surface. This is a grounding technique that raises awareness of your brain to gravity and to security.
Is
Reminding
this
yourself.
Thing of Joey Remedy's body scan.
I don't know if she does it. I've been doing it. I'm sure there's overlap. I mean, a body scan is a relaxation practice that's been around forever. Some progress like tense and release. This is just an awareness of surface. So I'm sure because
I do this quite often through the week when I'm feeling, as she says,
not quite right.
Not quite right.
Right. That's right.
And I go and sit in a chair, and you know, feel the back and like you've just done, you know, and it's really calming.
It is, and let me add to that. So I want those in the group who are listening to make sure that they, you know, if you try it, comment and let me know that you've tried it, because I don't think people always realize that they're sort of forward in their chair, they're into what they're doing, and they have this tension. And until you touch these and go, oh, I didn't even realize that, or oh, I didn't even realize I'm not in my chair, or maybe I'm sitting on one hip leaned over funny and not in balance. Huh? Yeah.
I'm so guilty of that. Like I like to lean forward and, you know, get involved, but I do need to remember to just feel the weight of the chair and everything.
When you need it, this will provide calm for you. But of course, I want you to be able to be forward and dynamic and involved in whatever you're doing. But if you get in this overwhelm or this not quite right state, then you use this as a strategy. And let me add one more piece to it that is an active calming piece. The neck has proprioceptors or position senses in it that communicate a lot with the vestibular system. And you know, our vestibular system tells us we're moving or we're still, and our neck tells us you're moving or you're still. So I'm going to use these to tell my brain I'm really not dizzy and moving by taking the hand and placing it flat on top.
Take the horns off.
Yes. So just the weight of your hand plus maybe 5 pounds. I don't know how to do kilos if y'all do that, but just the weight of a book or something on your head, pressing down. Make sure you're straight and vertical. So you don't want to be off balance. You want to have your sit bones in the chair, your feet on the floor, and then with your hand on your head, you're awakening the sensors in your neck that helps your head connect to your body and feel steady and secure. So the Barf technique, or the breathe, relax, and feel technique, is one of the first and most essential recovery strategies that I teach, using the body and the mind to calm.
The one that you've just done there, is that very similar to when someone stands opposite you and presses down on your shoulders if you're having a vertigo attack?
Well, sure. And yes, so any kind of compression
down.
Yes, compression it's two things. Compression of the joints excite the muscles. Muscles tell us where we are in space, whether our muscles are, you know, our core muscles. So compression of a joint awakens the muscle spindles and gives your brain a sense of stability. Also, straight down pressure orients us to gravity. And that's what our vestibular system is supposed to do for us. And when it's not working well, giving this touch and extra gravity is calming and orienting, helps us feel. My goal is to teach you to find that alone rather than depend on someone else. But I do have a video on my YouTube channel that says how to help a loved one who has vertigo, and it shows you how to come alongside them and how to touch them to make them feel good. It's always in this straight down position.
My husband, I taught him to put pressure on my shoulders.
Yes.
So if we're going out for a walk or something and I feel really disorganized, disequilibrium, you know, he'll stand there and push. You know.
But it's always both sides, and it's always straight down. So it can't be one side or off kilter. It is amplifying your sense of gravity.
Well, this is why I find, and the group knows this, that I hug trees pretty much every day. And I find that they're so solid and stable, and you know, the tree trunks are just really reassuring to me. So I hug them to get stability. And I imagine my feet are like their roots going into the ground, and it just really, really balances me. So that's why I'm a bit addicted to it.
So it is the beautiful thing. And so you're using an imagery and a whole sensory experience to feel steady, to feel steadiness. So whether you're imagining that you're hugging the tree or whether you're actually doing it.
I actually do it.
I know, I believe you, because they're strong and steady and connected. And you can see yourself in your mind's eye growing roots from your feet.
Yeah. Right. I'm conscious of the time, Kathleen. So just the next topic, obviously you did a lot of topics, but if I pick out the ones that people just wanted to touch upon, the diagnostic process.
Yes.
Obviously, it takes so long to get diagnosed. Is it because there's such a crossover of symptoms with vestibular conditions? You know, they're very, very similar in symptoms, some of them. Is that why it takes?
So the the vestibular system is one of those primary systems in the body. It connects with so many things, other parts of our body and other systems. So finding the right practitioner. If we start with a general practitioner, the first thing they're going to say is, "Tell me how you feel," and the word dizzy is very non-specific. So a lot of times the practitioner will say, "Tell me how you feel," without using the word dizzy. So in preparation for your initial visits, you should always think about, let me do something else, because dizzy is such a non-specific term. Am I floating? Am I lightheaded? Lightheaded could even mean low blood pressure or anemia or lots of things, a low blood sugar. So there's a lot of things that make you lightheaded. Some people feel heavy-headed, in which case it could be sinuses and all kinds of things. So the words we use to describe it are very important, and you want to try to explore as many words besides dizzy.
That's a really good tip, because the automatic thing people say is, "I am so dizzy."
Right.
And actually, I describe my dizziness as a shifting motion, like it's
shifting, drifting, tilting, rocking,
different directions, like this.
Yes. So you use movement words. So when I help direct people, and there's lots of tools, but I have people fill out, a form that has them check the boxes of what they feel, and it's looking at, are they sensitive to motion? Do they feel like they're moving, or do they feel just lightheaded? Is there a sense of equilibrium in the words, like off balance or being pulled? Some people feel like they're being pulled one way or the other.
Pulled,
Yes. So, the words that you use really do tell a lot of the story, whether we're going to just do blood work and make sure your blood sugar's okay, check your blood pressure and make sure you don't have low blood pressure. But the vestibular symptoms often have to do with a sense of vertical, a sense of self-motion, or I think the room is spinning, or I feel like I'm moving. A lot of times the eye movements and the eye coordination problems that come because of nystagmus are one of the things that people say, I just can't see, and I see everything looks like it's moving and I can't focus my eyes. So the words matter. And then it used to be different. It used to be that we would first try to decide, is this the brain that's the problem, or is it the vestibular system? And we called it central problems, like central nervous system, versus peripheral. But I think things have changed now. We're faster on the diagnostic. But we do want to know and make sure that the brain is normal. So a lot of times people will have a scan of the brain. But
we have an MRI straight away, actually. Yes.
Yes. And the protocols have changed now. It's not automatic that you'll have an MRI and immediately, because first they want to make sure if it's benign positional vertigo, for example, no MRI is necessary. Okay. So we kind of have this algorithm or this checklist that you go through the diagnostic process. And it leads the medical practitioners into what diagnostic tests are necessary. But the first and most common kind of vestibular disorder is benign positional vertigo. It's treatable with particle repositioning with a healthcare practitioner. No MRI is needed. You might get a hearing test to make sure that There's no hearing loss, but other than that, we send them straight away for rehabilitation. The story that people, go ahead.
Oh no, we call, I don't know if you call it ENG testing in the US.
Yes, ENG or VNG.
Vestibular testing.
So, and that would come if it's not BPPV. So you shouldn't even have to have that if you have.
The positional test is obviously the positional test. It determines whether you have the eye movements, whether you have BPPV. If it's not that, then they go on to ENG to rule out everything else.
Now, an ENT or an ear, nose, and throat or otolaryngologist will go send you to ENG, electron nystagmography. But a neurologist, if that's who you see, will send you to MRI. So it sort of depends on whether you're on the neurologist.
And I've seen them all.
Yes.
Audiologist, ENT, ENG, VRT, neurologist. Oh.
It's crazy the amount of yes.
The thing is, when you don't, obviously, I'm sure you get a lot of patients come to you that have already been through all of the system. They've been battered around the medical system. They've seen everyone I've mentioned. They've been to the general practitioner. They're lost. They're totally, and it's actually, when you don't know what's wrong with you, you just trust the GP is going to refer you to. They typically refer people to ENT. And then from ENT, then it goes maybe to neurology is what people then go to. And then it takes quite a long time to get back down to vestibular audiologist.
Well, and because, yes, so if the brain is normal and the reflexes are normal and the neurologist checks your eye movements and you can do all of that, they say your brain is normal. I don't have anything I can do with you. They'll send you to ENT. But some neurologists will treat vestibular migraine.
Okay.
Yes. So now the vestibular migraine could be treated by either the neurologist or the ENT.
I think there's a lot of people on the group that do see neurologists that do treat they're under them for vestibular migraine. And
yes, because they have that experience with headaches and those medications in general for the migraine. And so those people, you know, in the workup for migraine, you will probably have an MRI. And it used to be the reason we would do the MRI was to rule out an acoustic neuroma, because the most common head tumor is a benign head tumor on the hearing nerve. But I think that, you know, we've tried to do less MRI and less diagnostic testing as we try to keep costs, less MRI, yes, to keep costs down. If it's a viral problem and we think it's a labyrinthitis or a neuronitis, you know, we would be able to tell that from an ENG or a video nystagmography.
VEMP test diagnosed my...
The VEMP is...
caloric one.
Yeah, so here's the important thing to know about diagnostic testing. Now, I'm speaking about this from my experience as an expert witness in cases of medical disability with vestibular problems. I think this is also frustrating for the vestibular patient is because you can go through all the diagnostic tests and they can show normal, but you still do have a real vestibular problem. The most important thing for people to understand about vestibular diagnostics is that there is no way that is readily available to test the entire vestibular system.
No.
So if you have a positive test or a test that shows dysfunction, you can be pretty sure you really have a problem. However, if you have negative tests, it does not mean that you don't have a problem because part of the pie is missing in the diagnostics. An MRI can't show particles out of place for BPPV. So an MRI is negative, but you truly have rocks out of place in your inner ear, but we can't see them. So someone could argue there's nothing wrong with you. Well, we know that there is something wrong with you, and now we understand and accept and treat the positional vertigo quite readily. There are patients with vestibular migraine that might have normal MRI and normal ENG, but they still really have a problem. You could have loss of a certain canal function an injury from an infarct or a little mini stroke,
Yeah.
you know, that won't show up on a nerve, won't show up on an MRI because we can't measure with calorics or ENG testing all the canals. I don't know if this is too technical, but when they do the water and the air test in your ear, which is terrible, right? Do you know it's only testing one of the 3 canals? It's only testing, you know, this one that's closest to the eardrum.
Gosh.
So 30% of the vestibular system is all that's measured in caloric testing.
So my test results came up on the caloric and the VEMP. So I had 0% showing in that ear and 100, it was fine in that ear, but I had no balance in that side at all. And they did it so many times.
Wow. So did they do the ice water also?
Oh, they did.
It's painful.
It's awful. All these, and I refused to have them again in 2016 when I had retesting, but I had to go through the VEMP, but just to see, and I had them 3 times, but each year on year, it then went to 40%, then it went to 85%. So it did, you know, it wasn't, they thought it wasn't able to rejuvenate, but I changed my lifestyle. I gave up alcohol. I looked after myself. I exercised. I lost some weight, and I seemed to just, you know, they hadn't blown, luckily, and it was a bit of a medical mystery, but.
And let me just point out to people that when you're dizzy in the ENG, in the caloric test with the water or air, the dizziness is a normal reaction.
Yes, of course. They're bringing that on, aren't they?
And we know that we're doing that, and you feel terrible, but we get excited because we're like, it's working, yay. It's working, yay. But you know, we think it's the worst. So it would be, yes, people don't understand that when nothing happens with that change in temperature, that's really cause for concern. So it is a tough test to do. I mean, I did ENG testing and rotary chair testing, moving around in the chair. All of that for years, but I left people feeling terrible, and I decided that really all I wanted to do was heal people, which I believe we're able to do a good bit of clinical diagnostics. So for those who don't have access to a major medical center where they can get ENG or MRI or VEMPs and all of that, a good vestibular practitioner can get pretty darn close to knowing what's wrong with you by just taking your history and understanding your problems. And that's what my whole practice is. So most people don't have testing.
No, I was just about to say, actually, that at that point, I would say 70% of people that contact me don't get testing. They don't know how to get testing. Their GP or whoever they've been to doesn't offer that, or they won't refer them, or, you know, it's quite difficult to get it for some reason. But you know, it does rule out a lot of things.
It rules out things better than it rules in things.
Yeah, exactly. Yeah.
So
but
that is
you said a minute ago about vestibular migraine is more maybe on the historical and symptomatic side rather than the testing. There's no particular test that will say you've got vestibular migraine, but they'll see patterns. And I did a diary for a year, and I saw patterns, and that's when, you know, that was able for him to diagnose that.
Additionally, they would diagnose it if it responded to a certain drug that treats that. Sometimes you go, yep, that's it, because it got better with this. You know, sometimes that's the way. So again, it's really tough in this field for people, but I want to give hope to those who don't have a real diagnosis or absolute diagnosis based on diagnostic testing, because groups like this and information that's shared globally now can really help people with strategies and remedies to feel better, even without an absolute diagnosis. Now, if, you know, I'm not telling people not to go to the doctor for diagnostics. Of course, we want to make sure people don't have other medical issues. But I think that we all go to the internet and look to see who's my tribe, who has an illness like I do. I mean, otherwise perfectly healthy, but when I occasionally get this vestibular problem and whatever. We find people that fit our symptoms and try to make some guesses, and that happens just more and more now throughout the world.
Joey mentioned in my interview with her, which was really interesting, is the fact that people seek diagnosis, but actually to get medical clearance is the most important thing, and then after that we can then concentrate on the healing process. So actually to get the medical clearance, the MRI, the blood tests and all of that done, and then once you've got medical clearance, then you can move on to working on healing.
That's right. And medical clearance doesn't have to include an MRI, because if you have an annual physical, and we have extensive annual physicals, so do you, if there's no neurological signs, you don't have to have an MRI. So I mean, for me, medical clearance means a clear physical, that you've had blood work, that your doctor looks at you and says there's nothing wrong with you. And we can pretty confidently look at people who don't have any neurological signs of maybe multiple sclerosis or tumor or something, and say, your brain MRI is going to be fine. So we don't need to do it because there's no neurological.
Here that she paid privately in the end to have testing by an audiologist. In fact, I paid privately to begin with to have the NG testing, and I paid privately to have an MRI actually, right back in 2012. Another lady said I did a VEMP and other tests once, and that ruled out enough to send me to neurology. Happy I haven't had to repeat those. So yeah.
And it's an interesting thing about retesting, because I am not a big advocate for retesting over time. I think that if a person feels better, that's key. We might still find evidence of there to be a positive test on something, but the key is for you to get back to life. And that's why we're talking here, is for people to live their life, feel good again, and want to participate in activities. But occasionally retesting is needed because it depends. There can be technician error or interpretation error. Yeah. And I have seen that a lot. So if someone comes to me with test battery and test results, I look at the raw data. And if you've had a test battery and you want to get a second opinion, share your raw results with someone who specializes in diagnostics. And like I said, I've done expert testimony on it. I understand the interpretation and where people can make interpretation errors, or people can make errors even in test performance. Let's say, for example, we were talking about one the other day. This is a true story. Someone said, my eardrum is ruptured, but yet they diagnosed me based on water calorics. So you can't have a valid test result when you have a problem like that, for example. So there are still people interpreting results inaccurately, I'm sad to say, or doing tests technically incorrectly.
I had that done on me actually. I had there was an issue with the VEMP machine, the pads not picking up certain ones.
Right.
And she then had to go and change the battery, and then she was a junior, and bless her, she was lovely, but it all, and then we had to bring in another consultant. It was completely different, results.
Right.
So and I think there's me feeling depressed, her saying, well, actually you've got no function there, and then suddenly it was 40% the 2 years after. I was like, oh, thank God.
So I understand that. And I will look at people who maybe have been on their journey for 10 or 20 years, and they'll bring me the whole history. A lot of times, especially patients who travel out from far away to see me, I'll say, send me all your medical records first, because I really want to look at them. And you can see, like you're saying, well, I had 0 and now I have 40. Well, what if the 0 was wrong? You never really had 0, but that was an inaccurate test or a false positive test. So we look at trends, we listen to your story, and sometimes I say, I don't think that was valid. So you've in your mind thought you had this. And in Vita, we hear personal stories of people who even have said, I've had BPPV and Meniere's and migraine, and I'm going, no, you didn't have all those things. You just weren't diagnosed properly first, second, or third, or maybe you're still not. But it's not that you have all of these things wrong. It's that you've seen too many different people who have too many different opinions, bless your heart, you know?
Yeah, that's it. You do get a lot of different opinions, although they're all very clever and very good at what they do, but they do get different opinions. It's the part of, you know, that's just typical, really.
Yes.
Should we go on to the questions now? Okay, so this is quite an interesting, I mean, I have a lot of neck issues.
Yes.
and my neck issues are from doing, you know, over a year of VRT every day, 3 times a day. So it really just stiffened my neck up. But this question is quite interesting. I would like to know why I suffer so badly with neck and shoulder pain, and my giddiness
Yes.
always feels worse when this is tight. Surely where muscles are constricted, blood flow to the brain will be less, causing the giddiness. Is this part of VM, vestibular migraine, or just general tension in that area?
So you've asked me an either or question, and my answer would be yes and yes.
Yeah.
So sometimes it's both of those things. It's not a primary vestibular problem, but we call it a secondary vestibular problem. So it's secondary to the vestibular problem that your neck muscles and shoulder tension are increased. When your brain thinks that you're moving when you're not, guess what it wants to do? Tighten the muscles. Yeah. Stop the movement, because it might think you're doing this all the time. And so if your brain feels something off, or that it's tilted, if it's a static problem, your brain would interpret this. So then your muscles are going to try to correct that. So secondary to most all vestibular problems is a tension in the neck and head, and a pain at the base of the skull in the back. There's a couple of reasons for this. As I mentioned before, your muscles have these tension sensors. They're called spindles, and they tell us about position sense, and they tell us where we are in space and whether we're tilted and so forth. So the neck is really duplicating what our inner ear tells us about head position. So if our vestibular system is not working well, our neck will turn up the tension to try to sort it out. And it will turn up the tension to stop this feeling of our head bobbing. And being dizzy and having vertigo makes us fight or flight, anxious anyway. And the first things that happen is that we raise up these shoulders and tense. Another reason, this is another reason why this breathe, relax, and feel gravity pulling you straight down into the chair. Put your hand on your head and give yourself some joint sensation. This allows the neck muscles to relax. So the answer of yes and yes, I don't mean to be vague, but to say that it is part of it, but it's not primary. It's an adaptive response of your body saying, I want to stop this movement. I want to get more sensation. I want to feel steady.
And can anxiety on its own cause that?
Say again?
Can anxiety on its own cause that?
Well, sure. There's absolutely. So the answer is, let's give the brain what it wants and needs to feel steady without it being muscle tension. Okay? So I have done a variety of things. Posture. If you're holding your head forward and you have a forward head posture, your neck muscles are on overdrive. So the first thing is to fix your posture. Head over shoulders over hips in sitting. Ears over shoulders over hips in sitting and in standing.
I need to sit up more.
Because if I think of it like a bowling ball on a shelf, a bowling ball could sit on a narrow shelf, which is like our shoulders, if it's right in the middle. But it's going to fall if it's just a little off balance. So bowling ball of our head on our shoulders. Shoulders are back, chest is open. So getting this nice posture is essential. This is going to cause tension in the head and neck and pain here. So posture. The second thing is strengthen the neck muscles. And that's done by isometric exercise. Are you familiar with that word? That means, yes, using your muscles but not moving. So if I want to get my head from here to here and hold it there, I would do isometrics of 5-second reps, 5 seconds, 5 reps of 2 finger pressure, hold, 1, I'm pushing, hold, 1, 2, 3, 4, 5, release. This is number 2, 2, 3, 4, 5, release, and 3, 2, 3, 4, 5, release. So you do that 5 times, this way, this way, this way, and this way. So now you're building this strong tower, which is your neck, to hold your head steady.
Are you pushing against the fingers?
Yes.
Or are you pushing the fingers? Are you pushing your neck against the fingers, putting pressure against it?
I'm holding my neck in a nice erect posture and pushing it with my fingers, but not letting it move. So it's a both thing. You're matching the pressure of your fingers. You're matching it. So you're not moving. You're in an alignment and in vertical, and you're matching the pressure. So see what happens to the muscles? You know, you can feel them. Then it's here, and then it's here, and then it's here. So you're going around to strengthen the tower that holds your neck. That works 2 ways. It allows your muscles to relax and not be on overdrive when they get stronger. We want them strong all the way around. And tightening them, not overstretching them, makes them more sensitive and helps them make you feel steadier. So when your neck is strong and steady and core, like core strength, it's like they're having core strength here, it feels stable. Okay, so the remedy: posture, isometric exercise, and if there is persistent pain, trigger point therapy is very helpful for those trigger points.
I read a book about trigger point therapy.
Yes.
Brilliant.
Yes.
It's an American book.
Yes.
It
is. So, you know, I teach people to do their own trigger point therapy at the base of the neck, you know, using this. So this is a trigger point tool, and it goes with a book that I love. We could do a whole session on how to manage spasticity and trigger point.
What's it called?
Well, there's 2. One is this one. Is this the one you have?
That's the one I have. It's brilliant.
This is wonderful. And this, yes, it's brilliant. And it uses this cane.
Oh, I need to get the cane.
Okay, and then there's another one that is, sorry for you seeing my belly button. This one is for headaches and migraines.
Oh, I'm getting that.
And it also uses the Theracane. And so it shows you all these amazing pictures of, well, it shows you the posture and that I was talking about. My goodness, it even shows you how to treat TMJ, which can go with vestibular problems.
I was meant to have an MRI yesterday for my TMJ, but I didn't go. I've got it in the January, but I have TMJ in this side.
These are brilliant books. I love them both. They're wonderful in understanding the idea of the muscle, how muscle tension causes chronic pain, and how we can impact our muscle tone and tension with trigger point therapy. And self-treatment is possible. So I guide people to treat themselves, because I think that ultimately I don't want people to depend on me. I want you to become the therapist for your own body. You know it best.
I tend to depend on the acupuncture on my neck and shoulders. I have every 6 months, because it seems to release the tension in my neck quite a bit, actually. But maybe the trigger point thing I can do myself more at home, maybe save $1 or $2.
Well, I would definitely agree with that. Now, acupuncture is not well researched for vestibular problems, and in the research it doesn't show people like it. But I think acupressure holds a lot of promise. And I
hate it. I hate it when they tweak the needles.
Yeah, it's one of those complementary alternative approaches that is not proven, but if it helps you, great. I would say let's find a way for you to do it at home.
It does help me, but I think I might dig out that trigger point book again, because if I can do something at home that's similar, then with that big stick you had, great. So that's brilliant.
And a good therapist can reverse trigger points so that you don't have them, because likely it is a chronic posture or a chronic problem that is keeping those things from healing.
Yeah.
Think about the acupuncture. If you get the flow through that point and you balance that out the way acupuncture does, you ought to be balanced and fixed. If it's happening over and over again, then the key is, what are you doing that's putting the tension back there?
Well, I know that my posture, when I'm working at my desk on the computer, I'm hunched, and I'm, I can feel it when I go to bed. I can feel it in my neck, just like this person has said in there about their neck. It just feels tense, in pain. It's just sore, very, very tense, and I feel like I can't move my neck. And I think it is just my posture that I'm forgetting to, sit back in the chair and, strengthen these bits. No, that's really, really, really handy tips there. So the next question is about recovery, and she wants to know, have you seen any patients who have fully recovered, or is it a case of managing the symptoms of vestibular conditions long term?
Yes. We touched on that earlier, that outcomes are quite specific to the situation or to the diagnosis. So, of course, I have thousands of people who have recovered fully from benign positional vertigo of all types. So that is a dramatically treatable thing, but BPPV. Less than 10% of my patients will ever have it again, in my experience, and I have done thousands. But I have a strict protocol of repositioning that I think is thorough, and so it shouldn't come and go. Something like Meniere's disease can be managed, but we don't cure Meniere's disease necessarily. We learn to manage it with either dietary changes like low sodium diet, maybe diuretic medication, and sometimes then they go in and they do selective injections to the vestibular system on the one side to keep it from sort of these flare-ups. So I think Meniere's is chronic in that once you have it, you will always have it. Vestibularneuritis or labyrinthitis, those are injuries to or infection of the nerve or the vestibular system. And those typically, once the infection, the agent of infection is gone, that becomes a static or stable injury that should be able to be recovered from. So it makes sense from the science that if you have labyrinthitis or neuronitis, that once the infection is gone, and usually a viral, then you can recover by rebalancing your brain. It's like balancing the volume on speakers. If it's damaged one side, then your brain will do the adjustment.
Yeah,
and
I recovered from vestibular neuritis. So I was diagnosed with that in 2013 in the May, and I would say by the 2015 I was a lot better. So I did but I did change a lot of my lifestyle. Like I said earlier, I did start looking after myself more.
Many people who get this inner ear infection are treated with meclizine or dramamine initially to calm the symptoms. It does not treat the disease, but it calms the symptoms, and then your body fights it and it goes away and balances on its own. We know from research on animals that if you don't move and participate in activities of your body and your eyes and so forth, and get up and move about, you'll have a harder time recovering. So movement is essential to recovery of a vestibular problem like that. Vestibular migraines are one of those things that are managed, and they are chronic. And so that is a lifestyle and a dietary management along with medications. And there are many types of medications that might help you just sort of start going through them with your doctor until you find one that works. But it always should include, in the vestibular migraine patient, lifestyle trigger identification and management. So there are many migraine triggers, and for the vestibular migraine, it's no different. You have to make some.
You can definitely, well, from personal experience, you can definitely get a hold of vestibular migraines. I've living a much better life day to day now, managing my symptoms really well, as long as I keep on my personal treatment plan, which is
That's right.
water, diet, move to improve, exercise, walking, get out in nature, calming exercises, that as long as I stick to all that, I'm, more that.
And you've spoken a lot about mindset, Laura, and I love this about you, because you'll say, and you've even adopted the idea that, and accepted the idea that if I make these lifestyle changes, then I am healed or cured.
Yeah.
But, and there's a cost for you to go back to whatever those habits are or triggers. Some people make those choices more than others. They say, well, I don't want to give up chocolate, or I don't want to give up caffeine, or whatever their trigger is. You will always decide if you want wellness or illness.
Yeah.
And
I
so
I decided to give up alcohol, though I was advised strongly to, but I did myself do it, and caffeine and refined sugar, and I explored the gluten-free thing, the inflammatory side of stuff, and as I said before at the beginning, everybody's completely different in how they react to certain diets and certain foods and calming exercise and everything. But you have to find your own way with it. And
you do.
Yeah, and then once you've got it, it all slots in, and then as long as you're on it, then
it is a journey. And if we have a journey to wellness, I think it has to be a holistic one, because if we did everything the doctor prescribed, but we still don't feel well, we have to start chipping away at these other layers, including the diet and the anti-inflammatory diet. I mean, certainly inflammation is a big part of chronic illness of any type. So some of those questions said, I think someone asked on the chat, does vestibular neuritis recur, and does it damage the nerve inside the ear each time? This is Bach Carr. So this idea of a recurring neuritis, the itis meaning inflammation, is curious, because it's yes, if you have a repeat injury or repeat infection, you are likely to have a quantitative or an increase in damage to it each time. Okay, so it does damage the nerve each time. But my question is, why would you have a recurring vestibular neuritis? We then would start looking at maybe an autoimmune component, or an inflammatory component. So we would look at, why would you have recurring vestibular neuritis? It's not something that necessarily should come and go.
No.
So I would explore the inflammation in your body, look at your diet, and see why you're having this inflammation of the vestibular nerve repeatedly, and check that out. And then, of course, be cautious and maybe get tested for autoimmune components, because exposure to the virus that would cause a vestibular neuritis should not be a recurring thing. So
I think sometimes people forget that an imbalance isn't just vestibular, it's an imbalance maybe in the gut as well, an imbalance in your body somewhere. So, for example, years ago when I had lots of repeated viral attacks like tonsillitis that damaged the nerves every time, and then I was on antibiotics, and the more antibiotics I was on, the more it got rid of my friendly bacteria, and then I get more and more things come out, and then my body goes into meltdown, and then it's taken years to sort of get that back, with nutritious foods and to do gut healing. So actually,
absolutely. Well, so this idea of inflammation a lot of times does come from the fact that someone has what might be called a leaky gut, that our body is attacking things in our body because it sees them as foreign. And if you study and understand leaky gut syndrome or gut health and this good bugs and bad bugs and what's happening in the lining of our gut, our body turns on our immune system, turns it against us sometimes, or against the food that we eat that we shouldn't, because of gut health. So I think that's a really great way for people to think if they have a recurring infection, don't you, Laura?
Yeah, exactly. Yeah, because there is something off balance in your gut.
Yes.
Or something there that is recurring it. And if you're getting repeated infections, no matter where that is in the body, it could be up here, it could be in your feet or in your tummy, wherever, there's some imbalance in your gut. So there are, you know, things that can be done to balance that out.
It reminds me of a similar question that you asked when you asked on the chat about the tingling, crawling sensations, temples, top of head, forehead, shooting pain, and all of that. So again, it's the environment that our nerves live in and the environment that our brain conducts itself. And this sort of, when I hear those symptoms of crawling sensations and shooting and sharp and things, you know, you almost see lightning strikes, you know, and misfires of electrical activity. And that's absolutely true in our body because we're very electrical, and that's what our nerves and brain and spinal cord, they all are sending electrical signals. So to achieve optimal wellness is to try to keep things in check, even insofar as it goes with our nutrition and supplements and vitamins and making sure our food is nutritious, that there's enough water, sodium, potassium, magnesium, all these sorts of things for our body to electrically work well. So
but I've noticed with the crawling, so it's always on the left side here on my temple, and sometimes it comes sort of up here a little bit, but it's mainly here. But it comes in line maybe with headaches and increased dizziness, some imbalance of some sort of, you know, there's always some accompanying symptom with it. It's never on its own. So there must be some link to neck stiffness, posture, maybe what I'm eating, not enough water.
Well, there is. It could be anything. And then the idea is, what's the remedy? And sometimes when our nervous system isn't functioning well, it's going to give us a symptom and it wants some other feedback. And it's long been understood that certain sensations, different sensations, whether it be temperature or light touch or pressure or pinprick, those things travel at different speeds to our brain. So touching something, you know, with a firm touch is therapeutic in that it sort of covers or masks whatever pain we have. So when you have a crawling or a shooting or something, you know, the instinct is to touch it, but that's also very helpful. You can massage it, you can touch it. So there are all sorts of therapies related to that. Finding trigger points, acupressure points. There's several. I always work acupressure points on people's head.
Could it be linked to my TMJ?
Sure, absolutely.
Yeah. Okay.
So I would look for masseter soreness. You could go in the mouth and work those muscles. So absolutely it can be. So it's likely related to that. And the myofascial system of our body, which is our connective tissue and our muscles, can even pinch nerves that make them tingle or cramp or have shooting pain. So a lot of times it's a fascial problem in that the connective tissue pinches off those nerves when you get scar tissue or spasming. Right. So, but again, this book right here, I know has myofascial work for the jaw in it, and a good physiotherapist can help you with the myofascial treatments for wherever those things are. Okay, so where are we next?
Regarding VM and triple PD, do they have long-term effects on the eyes, as I suffer so much with them?
Yes, it's true. We might do another session on eye movement challenges, because I know that was one of the ones that someone asked about, and I wanted to talk about all the different kinds of eye movements. But when the vestibular system is not balanced right and left and signaling correctly to your brain, it has a real negative impact on the eyes. That and the fact that people with triple PD or vestibular migraine might limit their exposure to moving environments and busy environments, right? Yeah. The eyes, again, the eye muscles are skeletal muscles. If you don't use them, you'll lose them. So eye muscles can become weak just because we've changed our exposure to busy environments. But also the vestibular system can cause them to be uncoordinated and not work as accurately as they should, because the vestibular system allows me to look straight ahead at my nose or your nose while I turn my head. And I can only do that because of my vestibular system. When my vestibular system's broken, I turn my head and my eyes go off to the other side with my head movement, you see? So the vestibular system controls eye movements. So chronic vestibulopathy does cause chronic eye movements. We work to rehabilitate them, but that is essentially working to rebalance the vestibular system, counting on that neuroplasticity or the brain's ability to adapt. But eye exercises should be specifically prescribed for your problem. In years past, they gave the whole gamut of eye exercises, and I find people doing eye exercises they don't need.
Checkerboard ones and all sorts of
They have to be specific to what you need. You know, they have their speed specific, their direction specific, and then they're type specific. The eyes either move together or they move opposite. Like if I'm coming in towards my nose, you know, one's moving in right and one's moving left. So you can have, you know, where the eyes move opposite or whether they move together across or different kinds. So there's real specific eye movement rehabilitation. Make it specific to you by getting some help, maybe even through telemedicine. I do telemedicine eye movement consultations because I can see your eyes and I can prescribe the exercises. And I know I give people YouTube links to my videos to practice their eye exercises. So I would say if you've never done, for the person asking about the eye movement challenges, if you haven't had a full consultation with eye movement coordination therapist, then do that. Try the exercises, do them enough. They have to be done frequently enough at varying speeds, various directions, and things specific for you. I'm able to pick out where people need to modify their exercises.
Yeah. This is the worry of actually being in lockdown and not getting out and going to supermarkets and stimulation places, that if we come out of this virus, people are going to have, you know, to train their eyes a little bit more to get out in shops and more busy places because we haven't been subjected to that. So it's going to be interesting.
Yes. You must move around and shop around your house. I call it looking for dust, though. Go and look all around your house looking for dust on the top of the picture frames and straightening pictures. And
that. But in the same way, you know, can you actually go out for walks in nature and look and train your eyes in nature and look at leaves and flowers and bark on trees and stuff like that? Would that help still?
Absolutely. You know, clinical exercises with checkerboards and things, I always say, here's a way to do it if you're at home, but what I want you to do is live your life. What do you like to do? So one of the things I enjoy doing is creating an exercise program that someone says, this is fun, this is what I want to do anyway. I mean, I know it's difficult, it's challenging, but if you can be in nature, always be in nature. You need the fresh air, you need the movement. But I know that some people early on, they can't stand the wide open spaces, and so they need a more closed in space because there's a difference in getting those visual cues that are close to you for aligning yourself or when they're real far away. And there's scientific understanding. It makes sense to me why things close to you give you more of a visual reference than things farther away from you. But certainly for those chronic patients, getting outside and doing what you can is important. It is useful
of that. And also I found that when I was at my most acute stage, I used to go outside and I was out in nature, but then I used to get things like Alice in Wonderland syndrome because the space was so big. Everything would shrink into a little tiny hole. It was so frightening because my vision wasn't used to that massive environment around me. I was used to 4 walls and curtains and things like that. So it took
that's time
to get used to that.
So that's where the second most important thing I teach people. After breathe, relax, and feeling gravity pulling you straight down into your chair. We learn to do that in standing because when you're alone without visual reference, things are too far away for you to know how to orient to them. You have to feel your feet on the floor. You have to develop such a sensitivity to your feet that you know when you're even 2 degrees off of vertical. So it is training. When I had written resetting, did I put resetting vertical? Yeah, I did put that, and maybe that's too technical. I don't think anyone checked it. But resetting vertical comes from having such a key awareness of your foot pressure. I tell people this way, and this is a very practical, useful help for those listening. Imagine you have a plumb bob. Do you know what a plumb line is, or a plumb bob? A string with a weight on the end of it.
Okay.
A string with a weight on the end of it hanging from your belly button, and it hangs straight down. So it orients you to vertical, a plumb bob or a plumb line. So imagine you have a string with a weight on it, and it's hanging from your belly button, and it should hang right between your feet, just exactly between your feet, and it should be equal from heels and toes. So feeling the pressure in your feet and knowing whether you're forward on your toes or backward on your heels, or whether you're heavier on the right foot or the left foot. You learn to increase awareness of your foot sensation, and it will help you ground yourself. We talked about your feet growing roots into the dirt, connected to the earth, identifying vertical. That will relieve your fear, anxiety, and panic, and Alice in Wonderland syndrome.
Okay.
Nothing can orient to you. You have to feel and find gravity. Your vestibular system is lying, and it says that vertical is this way, but your feet are going to tell you it's this way.
I find that if I'm wearing really thick walking boots, I get a little bit more, imbalanced. And then sometimes the group will know this because I do it, bit of a Mother Earth thing, but I kick my shoes off and my socks off, and I'm on the grass. Yes. With my feet feeling the earth, and back to nature, and it just really grounds me. And I then imagine the roots and everything, but I like the ball tip as well. It's so helpful.
It is feeling that, and these soft cushioned shoes do impair your ability to feel the pressure in all those points of your feet. So being barefoot on a hardwood floor or a firm concrete or tile floor is the way to learn that and to feel that. And then going a bit further, yes, I love feet. I have a thing for feet.
The thing is, my husband, it does his head in, because I do not like to wear slippers, shoes, anything in the house. And I stub my feet, because they're quite big, on every single corner. Because I'm always barefoot, and he's like, for goodness sake, just wear some slippers. But I'm like, no, I don't feel grounded. I need to have my feet. Yeah.
Right. So, well, I could teach you to feel grounded, because obviously there are times where you need to wear shoes. And one of the things that I do is have people stand on a foam cushion. So this is a large foam cushion. You could pull a cushion off of your couch if you wanted to, or you could use a kind of therapy cushion like this. But if you stand on a soft surface for 30 seconds or 60 seconds, and then you step down onto the floor, you're going to feel like, oh, the floor is so
really solid.
Firm.
Yeah.
So oscillating between I don't feel anything in my feet, and then I step down, and boom, you feel it really loudly. Do you see? So we oscillate back and forth between that, so that we can train.
With carpet to stone floor.
What is it?
In my house, I've got carpet to stone floor, and that really, it makes me
feel the difference, right?
Yeah. On the stone floor than in the carpet.
Right. So you can train your sensitivity to be stronger, even when and carpet with thick padding might be luxurious, but it's bad for people who have.
I find I get really dizzy in my lounge with the thick. I've got really thick carpet.
Right.
I feel much more balanced on the stone floor.
That's
where luckily the kitchen's where I spend most of my time. Has got a stone floor, so
yes. So if you oscillated between the soft surface and compliant surface, we call it, and then the hard surface, you could train your brain to be more sensitive in that soft environment. So it does work that way, and that's a neat thing. People really feel better with that, and they help that. So the grounding is good.
Brilliant tip. Someone's asked, this is interesting actually, because I've been through this journey recently. I would like to know if it is possible to work a full-time job and recover, or any types of jobs that are easier on the vestibular system. I mean, it's taken me 18 months to go from part-time to full-time again, and train myself up on a computer again, and to, train up to be okay and not have a vertigo attack and everything like that. It has taken some time, but I've got there, and I'm 5 days a week and it's fine. But do you have people come to you that often say, oh, when can I work? And, can I work full time again? And all these questions.
Yes. So
work.
the goal again is to increase your ability to keep your nervous system calm and in control during whatever task you're doing. So if the person is, I can think of back to when a mailroom operator, where a mailroom technician, where they have to bend over and reach into one of those big mail bins. I don't even know if they do it that way anymore, but they used to have these big rolling bins that they put mail in. You have to lean over forward to do that. And every time they lean their head over into the bucket, they'd get dizzy. We practiced those things. We trained for those things so that he could be grounded enough in his feet and stable enough so that he could move his whole body down and come back up. So retraining for a job is very task specific, and it's not impossible for you to retrain for whatever is the noxious or adverse or triggering thing about your job that's keeping you from working full time. If it's watching moving things on a screen, then people are using adaptive glasses, colored lenses to help them with computer time. And we adapt and we retrain so that you would, if you need to watch a ticker go across the bottom, like this, that moves, if you have to look at things that are moving, if that bothers you, then you would start doing that and you'd watch this thing go by, and I would teach you to breathe, relax, and feel your bottom in the chair. Tell yourself you're steady. Maybe you practice not letting that trigger you, and you increase the amount of time that you can use strategies to tolerate whatever is bothering you. So it is a gradual training of training the brain to be able to tolerate different things depending on your job. Of course, if you have a chronic vestibular problem like triple PD or migraines that aren't managed, or even Meniere's disease that's not managed, some people do have to adjust their workplace. Before COVID, we had people adapt by working half-time in the office, half-time at home. Mm-hmm. But certainly, if visual motion is a problem for you, make sure that your office environment is set up so that you're not looking out a window or looking out at an office or anyone else moving, but that you have calm visual environment. Control that as much as you can. If you get dizzy and lightheaded and giddy in your head, make sure your feet are on the floor. I have a little thing that's on the floor where I put my feet on.
Oh yeah, I was going to get one of my husband's for that for Christmas.
Yeah, so because I'm kind of short and I want to sit in my chair, so I bring the floor to me. Mm-hmm. So make sure that the surface comes to you and supports you so that you feel steady all the time. A lot of times people's vertigo is reduced in sitting, even when I put a towel roll in the small of their back to support their posture, because that contact and putting a towel roll, do you know what I mean? Roll up a towel, put it in the small of your back to support your spine. It allows me to use less energy.
Is that the same thing as another thing I was going to get my husband, because he has chronic back.
A lumbar roll?
He's got spondylitis, ankylosing spondylitis. So I was going to get him one of these. I mean, my chair here is, I don't know if you can see it, but it's quite...
Yes, an orthopedic chair that has...
It's got no support that way. So I was going to get him one of those support things that supports and goes into the spine. Yes. So is that the similar thing? Like you can...
So it is. So we want to give our body a sense of stillness. So if we could be in a custom molded chair that curves like around
chair
and hugs you, it would make you feel steady. And it would make you feel connected, and it would make you feel calmer. Remember, when you have a chronic vestibular problem, your brain is working overtime to sort out this mismatch. So then to deal with the fact that you have cognitive fatigue or low cognitive endurance is to try to comfort your body so that your mind can work on the task at hand rather than on saying, okay, that's moving over here and that doesn't have anything to do with me. And I got to hold my balance in my chair because my chair is not supportive. There's all sorts of things that if you cocoon yourself in and you control your environment, it will free up your brain energy to do your task at hand. That will allow you to work longer.
Yeah. Okay.
So
and
think about
fatigue. You mentioned about fatigue. A lot of, and that is the word that comes up an awful lot about people that I support and on the group. I was told by my vestibular therapist years ago that, because I said to her, when it gets towards 2 or 3 p.m. in the afternoon, I feel so absolutely shattered. And she said, it's because your brain is trying to compensate throughout the day. It's getting tired, cognitively tired, isn't it? Is that right?
Well, it is. So remember, the vestibular system is one of the most primitive systems in the body. To know which way is up and to know whether we're moving or not is essential, and it affects everything. When that system isn't working well, it causes alarm naturally in our brain. And so our brain is trying to figure it out. Am I moving? Is the environment moving? Does that have anything to do with me? Have you ever sat at a stop sign and a car beside you starts to roll and you slam on the brakes because you think that that car's movement has something to do with you? So the brain is having to sort of play referee on all the stimulation coming into your body all day, and it's exhausting. So it's important, especially for family members and loved ones of people with vestibular disorders, to understand that that's where that fatigue comes from. And that's why regular scheduled breaks in the day are essential.
So in the work day, to have schedule breaks and everything.
Plan them, take them before you're feeling bad, and structure them so that they're efficient. So what I mean by that is, before you start to feel bad, have your break scheduled. Go to it and get to it. Have a plan. If it means I'm going to lay flat in the lounge, if there's a lounge there, or I'm going to go to lay flat on the floor, or I'm going to sit in a lotus position. It doesn't matter what it is for you, but get right to it. Get to your breath, get to your sensation, take your break. And it's always going to need to involve a type of grounding or breathing, relaxing, and feeling for it to be effective. Eyes open or closed does not matter. That's up to you. You could fixate on an object or you could close your eyes completely. The reason I like to have people close their eyes is because it makes them feel more of the surface and pressure and gravity, and that's more healing than fixating with vision. I want people to not depend on their vision, but I want them to feel contentment and certainty in their body minus vision. So get right to it, have a plan, do it, then get back to work. And that's just something that has to become a part of your routine.
I went live on this particular topic the other day, actually, in the group, and it was about scheduling. And it was about planning your day, because I think a lot of people scattergun and go through the day. They've got to go to work, they've got to come back, they've got to eat, they've got to sleep. They don't think trying to break it down into little bite-sized pieces is better, because then you can plan your breaks, preventative. You know, okay, 10:30 I'm going to have a break, even though I don't feel like I need one. I'm going to have one.
Right.
And, you know, batch making food so that when you come in from work, you don't sort of having to, you know, you're knackered from work anyway, to have something ready for when you get in, and then you've got more time to relax after. So we were talking about that in a live the other day. It was quite interesting.
It is true that while it's not natural for every person to have a disciplined personality, those who have self-discipline and can make structure and follow it do better. It is true. Yeah. Those who are a natural free spirit and sort of adrenaline junkies.
I have to say, I'm not very organized in my work ethic. I'm not very organized. I'm not very scheduled, but I have to be. I have to force myself to try, and sometimes I forget, so I have to write it down. So I have things, you know, my to-do list. Part of my to-do list of the day, work-wise, is in red my breaks and my, you know, breaks.
It's harder if it's not natural for you. You have to work at that, and you have to know that it's important that you learn that to to manage your symptoms.
But
Yes,
going
it's
back
true.
to the type of work people, she was asking about what type of sort of work can people do as far as I see, we have everybody in the group have a lot of different, and people outside the group that I speak to on Instagram and everything have very, very different jobs. Some people are nurses, some people are teachers, some people are dustbin people, some people are corporate marketing,
Right.
lots of computer work, some people are in investment banking. There's so many different, a lot of vestibular migraine people and vestibular patients can do a lot of different jobs. So it's possible.
It is possible, and it's pretty diagnosis specific.
Yeah.
I think. But if motion, is one of the things that you can't tolerate, motion, know that you need to move to really recover. And so I would hate to say you need to isolate yourself and remove yourself from all stimulation, but that might be where you feel best. But then you lead to, we talk about agoraphobia really being at high risk for those who have vestibular problems. You get to where you're so shut in, you fear, and you have anxiety about being out in the open.
I was agoraphobic for 3 years, 2012 to 2015, and I was at my worst, and that was why, because I didn't move and I didn't exercise as much, and the difference to when I came out of that, feeling, it was amazing. I really did improve from 2015 onwards.
But I would say that you're going to have a better chance of feeling better and focusing your cognitive attention to the task at hand if you minimize other distractions and stimulation. So don't have the TV on while you're trying to focus, or try to make it quiet. You don't have to have music. You might have a white noise if you want to, if that helps you, or if you have tinnitus, you could have a white noise in the background. But you really, shouldn't be doing two things at once. We tell our children, you can't really do math and,
my children do homework and watch the TV. I'm like,
they can't do it, and nor can we. And especially we can't multitask. When you have a vestibular problem, you just can't. So give yourself some grace and some self-love, and know that there's, that you're working through a challenge, and you may not regain the ability to do 12 things at once like you could before, because your brain is just having to make up for a deficit, and it can do it, but only under certain structured conditions.
That's
so
good advice.
Give yourself permission to control your environment.
All right to go through. We've got 3 questions left. Are you all right to?
Is anybody still listening?
Yeah, we got 7.
Yay! Well, people will watch it later. So long. Well, I think this is all really rich and really informative. So I'm happy to go on again.
Well, we've just got 3 left, and I think some of it.
Go ahead.
Some of it touches on stuff we've actually spoken about. So what are some causes of pain in the face but not the forehead, and how can I find pain relief? Is it VM related, even though I sometimes get it on days when I don't have other migraine symptoms? So maybe talking about nerve shooting pains or something, or I get a lot of nerve funny shooting pains and stuff.
Yeah. When people have facial pain, well, I don't know if this person has a surgical history. If you have a surgical history of inner ear surgery or any type, we do, of course, are always careful about the facial nerve, because it can be involved or nicked or impaired when there's a problem in the inner ear. The facial nerve travels right there. So, if you've seen a doctor about it and they say there's nothing wrong with that facial nerve, and you're just having symptoms of it, I would again go back to the possibility that that there's a myofascial component or an inflammatory component to that. So there are pressure points, trigger points on and around the face. There's facial massage that can be done, and there's fitness of the nerves that comes with even proper diet and hydration that helps the nerves stay healthy. So I think it could be several different things, but if there is surgery, I would make sure that you check to make sure that you don't have a nerve damage. Some infections or mastoiditis that affect the inner ear can cause a facial nerve disturbance. 2, if, you know, they have to go in and clean out an infection. Head injuries can cause facial nerve issues as well, and pain around the face if there's trauma to the head and tension in those nerves from a concussion injury. Someone in the group is asking about, can head injuries cause vestibular problems? And the answer is absolutely yes. You know, the vestibular system is very, very fragile. While this model is hard plastic, the vestibular system itself is very fragile. It's surrounded in bone casing to protect it, because if it's shaken, it can become damaged. And so it is highly susceptible to what's called a vestibular concussion syndrome, which is really the vestibular symptoms that come with a concussion, because it is shaken and damaged. So with or without loss of consciousness, yes, you can have a vestibular problem from an accident or whiplash injury. In fact, at one time we were quoting a statistic that 85% of concussion patients had vestibular symptoms or signs afterwards. Oh. And the vestibular testing is part of the courtside concussion tests in sports injuries. So that's one of the first things we look for when we have concussion in sports, is vestibular symptoms. So it is very fragile to that. But on the face, you know, I'd probably get in and ask some more questions, but I would start touching it, I would start moving it, and I would start seeing, you know,
yeah, that's my automatic thing when I get nerve pain from my TMJ, is I just have to massage it, and it does seem to help. I also massage the other side just in case it's referred. But you know,
it can be referred, and that's where that trigger point book comes in, because I would also involve the base of the neck. You press around and see where referred pain might go. So sometimes you can touch a place and it then says, oh, that hurts my jaw, but you're not even touching your jaw.
I know, it's bizarre. It's all connected.
Exactly. So those are referred pain patterns, and they are well understood, and that's sort of the science behind the trigger point treatments and energy medicine and trigger point therapy, myofascial things. It's nerves being tangled in connective tissue. So start by touching yourself. I was going to say that about anybody who has numbness or tingling or funny feelings. If all else is good in your medical history and you don't have real nerve damage, touch yourself, love yourself, connect with your body. Remember, honor your body and it'll honor you. I'm astounded when I hear people say, no, I don't touch or massage myself. I said, you need to. You can even give yourself a hug. I'm teaching you how to press down and give yourself grounding and orientation. You need to touch all of you. If for some reason you haven't, begin doing that, because that's part of self-love. And if someone's ever hurt you and made you afraid to touch and love yourself, you might experience great emotion the first time you start to do that. But self-love and self-touch is essential part of self-care. So begin doing it, and pressing and rubbing and touching and whatever you need to do to allow yourself those sensations, because these body sensations will send messages to your brain that actually interrupt bad feelings we have from our inner ear. They travel faster. They're there for you. So allow yourself to self-soothe. Like we say, babies do that, you know, they self-soothe. And we should self-soothe with touch and movement and positioning. So, so do that. Go home and touch yourself, the doctor said.
I'm interested in a particular exercise or rehab that will help me reacclimatize to computers, really struggling with them at a bad relapse in September. Not able to work at the moment as job is desk-based. I think we touched upon this earlier.
We did. So sometimes it's movement of the computer screen, and sometimes it's the lights. So there are light filtering lenses that are quite popular now. These filter out blue light, and they're designed to go over glasses. That's why these are so big, because sometimes I wear these.
Are those the ones that Alicia Dizzy Cook has got?
These are by TheraSpec, but there are some other brands as well. These are TheraSpecs, and actually, if your group is interested, I have a discount code too.
Yes.
This So the word is theraspect. Does this come out forward or backwards? See the
No,
word?
that's fine. That's fine.
Theraspect.
Yeah.
And then I'll put the code in the chat, because if you put theraspecs.com with the code InHarmony, you can get $10 off your order, except that's American dollars. But I know they ship. Anyway, there's research to support that if we minimize certain parts of the light spectrum, it helps us tolerate the lights of the computers better, and it decreases fatigue and even decreases light sensitivity that may lead to migraines. So a lot of research ongoing with light controlling glasses, but my patients are very positive on these, and people with migraine headaches in general are finding them helpful. So if you're working on increasing your tolerance of the computer and it's the light, not the motion, try some light glasses, Theraspecs. I'll put that in the chat down below and offer you a discount for that. I think that's worth trying.
Well, I also think that just having been through this journey with the computer, because the computer was one of my biggest vertigo triggers, actually, as well as my iPhone. So I remember being on the computer far too long, you know, in the past times when I was chronic, and it would cause me to have really bad attacks. So I broke it down into smaller. In fact, my consultant did say to me, right, you need to have much more breaks in between shorter periods, and actually that helped me train my brain to get used to the computer better. When I was just on the computer for half an hour, and then I would have a 10-minute break and then go back on for half an hour. So you know, rather than be on the computer for 2 hours, because you can get lost in work, and be on it, suddenly you're on it for 2 to 3 hours non-stop, and that just didn't work very well for me. So even to this day, I tend to not be on it for longer than a half an hour, but it's just a sort of discipline thing, I think, just to and that just helped train my brain to sort of cope with it better.
That's a great strategy. Also, technology has improved with the adaptive things that you can do. Make the words larger. Make your screen less busy. Sometimes people are more comfortable reading light on dark. So on your iPhone, you can make it so that you have a dark background.
Yeah.
You can make your computer amber hued, I think even your phone. So check with the technology that you have and someone who has the know-how to say, can I make it not so bright, or can I go light on dark, change your back, you know, the background setting, or even an amber hue on your laptop or your desktop computer. Decreasing the amount of blue and white light that comes in will help you tolerate it better. Or amber lights above, like I have lights that I can change from dark to warm. I mean cool to warm. So that's a cool with a blue, and then that goes yellow, that is orange. So
interesting, because I find that I can only use a computer on, I mean, I'm getting quite a headache now because I'm, you know, it's got dark and, you know, fake lighting, and the computer's bright and everything. So, but in the day when I'm working, I find it so much easier to have the computer next to natural light. And then
because it's not, yes, because it's not strobing.
Yeah.
Because sometimes people are sensitive to a light strobing that they may not even really see, but particularly fluorescent lighting can trigger because of the strobing. So I recommend warm light in a non-strobing bulb, which is probably your LED bulb these days, and that is warm, in the warm, more orange than blue. Okay. And if you under fluorescent lights, the long tubes, you know, those are terrible because they start strobing naturally with the life of the bulb. So lighting is a very interesting science to study.
My husband has these Philips Hue strip.
Yes, we have those.
And he changes the colors on them.
Yes.
I cannot tolerate the bright reds and the blues, but I seem to be better with the soft creams and the you know, the purples and stuff are kind of okay, but it's a certain hues that I'm really, really.
It is. Yes. I love that hue system. We have it throughout our house. And my husband loves, we don't love the same colors, but certainly the more calming, they have an impact on the nervous system, and we're able to study and see what the brain does under different lighting conditions. And so those warm hues are a different part of the light spectrum, and they are more calming. But play with it for you, and know that light matters, and strobing fluorescent lights are not helpful. They're hurtful, and LEDs that change colors are nice. Not change colors, but that you
I know what you mean.
pick the colors that you like best, and it's probably going to be a warm.
Right, we've got one last question. Right, this is quite interesting actually, because obviously when we have anxiety, we have vestibular issues and symptoms, we do stop ourselves from doing certain things. And she said, would she advise doing things that we've stopped doing because of our condition and the anxiety around it? For example, roller skating, swimming, boats, gyms, funfair rides. The list is endless, really. I just wonder whether the VM would flare up and we just work through it, or is the anxiety around doing things again that creates the giddiness, and it's more anxiety rather than VM that stops us doing these things, and we would be fine, but we're just scared to try it again. So yeah, I mean, it's similar to my fear of getting on a boat again, or going on a roller coaster, or getting on ice skates, and I'm automatically say no. When actually maybe I should try it. What you know, have you had any success in sort of people reigniting those activities?
So what we do know is that to recover from a vestibular disorder is to move. So movement is essential. The idea of avoiding movement or avoiding an active lifestyle is, you know, works against recovery. So we do know that. We know that movement is essential, and early mobilization is important for vestibular recovery. When it comes to things outside of normal mobility, like walking and moving and cleaning our house and driving and things like that, these extra things like amusement parks and other adventures, it has to be supported by a desire. So think about, again, you're going to do a comparison of pros and cons. The pros is, like for me, returning to skiing. I enjoy it. I want to do it. I want to try it. I'm going to give myself grace to know that I'm going to try to train for it. And if I can't do it, I'll be okay and still be at peace with myself. Yeah. But so first there has to be a desire. If there's no desire, there's no need to go on a roller coaster. But if it's something you want to do and you want to try it, begin training for it by exposing and mimicking what you think that looks like at home. And you can do that with up and down movements or rolling or moving or whatever it is, all kinds of things. I mean, even me just moving my head like that, for some of you, you go, no, I can't do that. If you can't do that, then you're not going to want to be on a roller coaster.
I think people are often scared that it's going to set them back when they've got to a certain point.
It absolutely can. That's why I'm telling you, mimic it at home before you go, so your body says, oh, I know what that's going to be like. It's not so foreign. Yeah. You can't jump blindly into it without preparation. Just like for me, I didn't put my skis on and head down the mountain. I had been skiing in my kitchen for months and months and months. Brilliant. And doing all the things. So my body says, I know what to do. I know what to do. Okay? So you must prepare. You must have desire. You must have discipline and prepare so that it is not, because if it's new to you when you get there, your body will go into fight and flight and freeze, and you'll have a panic attack. Of course you will. So you're going to image it. You're going to see yourself doing it. You're going to make sure your breathing is regulated while you see yourself doing it. And you're going to practice the movements so that you can remain calm and tolerant using strategies and grounding while you do it. It is a personal decision whether you resume active, things that you did before. They the reason they set you back is not because they make the problem worse. It is the anxiety and the fear of anxiety and the neurological experience that comes with being in that fight or flight and freeze, and that will make you worse. But, you know, it's not going to make a vestibular problem worse unless it's benign positional vertigo and moving in some way causes those particles to dislodge again. But again, that's not even likely I mean, it is likely. Like I tell my BPPV patients, if you want to do downward dog or yoga poses that put your head below your shoulders, you may go back and do those if your BPPV is better. Understand that those things might put you at risk for having BPPV again, but then come back and see me and we'll fix it. And then at some point someone says, oh, if it's chronic for them and they keep getting it over and over and over again, they might decide it's not worth it, I'm not going to do it. But I love to get people to a place where they feel free to try things in life and to do the things that bring them joy.
I think someone misses horse riding here. She was an avid horse rider and not been able to ride for a year, desperate to get my symptoms under control to ride again. That's sad. It's something that you've really loved to do, and the fear is stopping you from trying it again or practicing at home, you know.
The gait of the horse is so therapeutic. You know how they use horse riding even to help patients with neurological problems and children and brain injured and whatever. So to walk a horse and be on its back in that rhythmic gait is so beautiful and natural for what it does to the pelvis and the nervous system and the trunk. So for this one who is a trained rider, you know what that connection is to that horse. You know that you can be grounded into the back of that horse while you're walking with it, even though your legs are in the stirrups and not on the ground. So I would say that it could be a beautiful somatosensory whole body experience of connecting to that horse, making sure that you're in a saddle that you feel like fits you, and that your feet are firmly in those stirrups, and that you're holding on, but that you're breathing, relaxing, and feeling and becoming one with that horse, which is what a good rider does. And that it could be a beautiful experience to only walk the horse. Later on, you progress through. But I think I can, in my mind's eye, I can see what a beautiful experience that is to become one with that horse and just be on it. So I would say yes, yes, and yes. Go be with the horse. Start your experience by touching the horse, getting close to it, making sure that you have a relationship with it. Go to its face. You know, all the things that you can do with the horse to connect with it and to trust it. Let it trust you. You know that the horse will feel your anxiety if you have it. So you've got to get to a place where you're calm, relaxed, and in control, or else the horse will sense it. So it's especially important that you connect with that horse first.
She says, thank you for the wonderful answer. And I think it's a really good answer, because actually my children, when they got old enough, but I was chronic, they started horse riding when they were quite young. And I was really sad because I used to horse ride a lot when I was younger. And I just didn't feel like I was ready to get on a horse at that point because I was pretty acute. But then as they went through their journey of riding and getting to know the horses and everything, I did have 2 lessons with them and I loved it. And actually, you're right, the groundingness of the seat and the back of the horse and the feel of the horse, it just is really quite calming. And if it's something you love doing, and you know it makes you enjoy it, then the practice is, you know, well, practice makes perfect, I suppose. But yeah.
Well, I want to hear back about that experience, because that is a beautiful thing. And that is movement, controlled movement in rhythm, and rhythmic walking and rhythmic riding is a beautiful thing. And we're going to, as a vestibular patient, we tolerate rhythmic movements before we tolerate sporadic movements. So anything that goes in a rhythm like that is great.
I'm just going to two more things and then we'll wrap up, because obviously conscious of your time. Just going back, there was someone that was wondering, how do they start on the sort of complementary journey? Where do they start? It's such a minefield, you know.
Yes. Well, I saw that question, and I think I can understand that overwhelm. Where do I begin? Think first about what symptoms you're trying to control. Are you trying to sleep better? If you're trying to sleep better at home, start simple. Think about something that's well researched, like lavender, really helping.
Love lavender.
Helping you with sleep. So something as simple as a real pure natural essential oil, has to be quality, can really enhance sleep. So think about what you want out of it and then what works for you. If you want to something to get your creative juices flowing because you want to start working in the morning and get moving in the morning and feel better and start moving, you might add a yoga practice to your morning. You know, learning a few simple poses in the morning can really help you orient to the ground yourself, and help you feel steady to continue on the day. You know, and that's a complementary alternative approach. If you want to calm nausea or that comes with that, then you might think about, well, you know, what could you do for that? There are a variety of things that help with that in terms of looking at the foods that you're eating, or trying, I was about to say ginger, but ginger is actually proven not to help nausea that comes from a vestibular disorders. It helps pregnancy-induced nausea and vomiting, but not vestibular. So there's several different nausea tracks, and that's a whole nother conversation. So things that work for some, I know, if you felt nausea from vestibular problem, you could try some acupressure points. You might even try this P6 point that's 3 fingers down below your wrist and pushing right here, and, you know, using an acupressure to see if it helps you. All the acupressure points we've talked about, there are many. You could get a book or go online and learn about that. That's an alternative that might help you too. Herbal remedies and things, you know, aren't necessarily helpful for vestibular problems specifically, but if you were to look at supplements and nutritional supplements that might help you with brain fog or inflammation or anxiety. A lot of patients with vestibular problems are given drugs for anxiety, but there are also ways to use complementary and alternative approaches to decrease anxiety, even in terms of deep breathing. And mindfulness is getting a lot of attention. Mindfulness, from the idea of being in the moment, being aware of self and regulating breath, and recognizing and giving yourself grace to feel what you're going to feel, accept whatever you feel, and do something with it. So the idea of being in the moment and mindfulness is also another place to start. And I think there's a lot of apps that can come on the phone. My watch will tell me when it's time to breathe, to get those deep cleansing breaths. Apps will remind you to do a meditation. Use your technology to find the complementary and alternative approaches that will fit your lifestyle. So, you know, start with something, try it, move on if it doesn't help. Consult with me online and I'll help you get started depending on your symptoms. But it's trial and error, because really there's not a lot of research that's going to tell you. There's no best place to start. It's what you have access to and what you want to do.
Yeah. Well, Kathleen.
Losing my voice.
I'm not surprised. 2 hours 26. Oh gosh, you've been amazing. Thank you so much. I'm losing my voice too. So
I hope that I can come again. This was really fun, and if there are things that I said I need to expand on in the comments, I will. I'm happy to share with y'all any YouTube videos I have. I really am losing my voice now.
Yeah. Well, I think actually one topic would be great to do at some point next year would be dietary sort of area, because I think that sort of thing would be amazing.
Did you have the Dizzy Cook on in your group yet?
Did I have what? Sorry?
Have you had Alicia Wolf in the group?
It's going to be my next one. As in, I know her very well, so that's a conversation I'm going to be having with her next year. So she'll see this and go, yay!
Yeah, it would be great to have her on. She has a lot of videos too. She covers it well. I do want to make sure, I hope it's okay, Laura, I'd like to give a real formal plug for the Vestibular Disorders Association, if I might.
Go ahead.
I'd like people to know that they can go to vestibular.org if you know Lauren, you're in this group, you probably already know about it, but know that we are working hard to give people the information that they need. And we do have worldwide providers and practitioners listed on our website if you need a healthcare provider in your area. That list is growing as providers join with us and allow us to list them in the healthcare directory, but you can go as simply as put in your country or your zip code and find a vestibular specialist in your area. And I think our mission at VITA is to provide accurate and efficient diagnosis and treatment for people all over the world. And so we want you to find the healthcare professional that will help you. My disclosure, which I forgot to do at the beginning, is I am currently the president of the Vestibular Disorders Association Board of Directors. We depend and need your financial support. Go and donate today. Thank you all for the opportunity to come. And I would love to come back. I just wish you many blessings of health and happiness. And so
Absolutely.
thank you all.
I'm wishing you a Merry Christmas as well, and stay safe and well. And we'll talk about doing something next year. It'd be great.
I would love it. Be well. Bye-bye.
Thank you, Kathleen.